What advice would you give someone who has just been diagnosed with Merkel?
Don't jump so fast that you make a big regrettable mistake later. And going too fast and too far in any one direction can be a problem. If you only use surgery and do a huge surgical excision, that could cause a number of problems down the line. Or if you only do radiation, or you only do immunotherapy or something, you really need to think collectively amongst a number of experts about what the right plan is. So first, don't freak out, gather information, don't sit around and do nothing, but choose carefully which direction you go in, and you need a team that's familiar with this cancer. And there are a couple dozen in the United States, I would say. But you don't want to go with somebody who just says, oh, it's just like this other kind of cancer that I take care of. You don't really want that. You need somebody who knows this cancer.
What are some common mistakes that doctors and patients make at the start of treating Merkel?
Well, mistakes by the patient, mistakes by the team, mistakes in management, we can break them up a tiny bit. I think mistakes by the patient would be just blindly trusting the first person that they're being managed by and really believing that somebody, just because they're a, quote, doctor, would absolutely know how to manage a rare thing. So that's a pretty big patient mistake to make. You need to have a little bit of suspicion and a little bit of attention in making sure that you're really getting the correct multidisciplinary kind of input. Mistakes by the team might be an over-reliance on one approach. That'd be the most common. Just cut massively or just radiate very extensively and leave the other options off of the table. That's an unfortunate common mistake. Motivation at the beginning is, God, I want to beat this cancer. I don't care about the side effects. I want to beat this cancer. And so I've been at this long enough so that I'm seeing people 5 and 10 and 15 years later, and I see these side effects, usually in the 6 to 10 year range, where I'm thinking, man, I wish we hadn't done so much of that. We cured the cancer, but we have this other, leg swelling that we'll never get rid of. And it's really messing up this person's life. So I'm very motivated to try and find approaches that are not excessive. Fighting cancer and waging a war wisely, intelligently, are highly analogous. And to say you're only going to use ground troops, or you're only going to use amphibious, or you're only going to use air, and you're not going to use, intelligence and or encryption, or you need all of your weapons. And to just say it's going to be a water battle only, big mistake.
How do you put together a team for treatment?
You do need people with expertise in surgery, radiation, medical oncology, dermatology. You need several of those things to come together and communicate in order to have confidence that you have a well-considered plan. So how do you find an appropriate expert? So there's at least a couple possible answers to that. And one is perhaps your local team that doesn't do this all the time. As long as they're interested in learning and supportive and collaborative, that can work great. That's one answer. They can't necessarily do everything. They won't be able to do everything unless they take care of this a lot, but they can then work with the team. And many teams, including ours, is willing to work very much remotely with a patient's local team. Then you need to make sure that you're going to a team that has everything represented and that I think you feel comfortable with and like they're knowledgeable and taking into account all of these factors that you might end up reading about. Our website, merkelcell.org, has information about surgery and radiation and immunotherapy and sentinel lymph node biopsy and some of those early important things. And if you know, by reading that for 1 hour, if you know more about this cancer than your team does, that is a red flag. It's not about the reputation of the cancer center. There may be a very prominent cancer center which currently has not a single person who focuses on this particular rare cancer. So you can't just say, oh, it's Fancy Cancer Center, I'm guaranteed to get great care, number one. And number two, just because they're a very, very talented physician and excellent in some other area, that does not mean that they know what's going on with this particularly, rare cancer, that you don't want to invest a ton of your time learning about it if you're not seeing patients with it. This cancer is different than others, and you can't just treat it with surgery up front. You need to integrate some radiation often and or some immunotherapy, and what you really need is to gather the facts and have an experienced team make a plan with you.